Hello sir, good evening.
Good evening.
I'm Sympli Euginia. I'm a second year medical student and I will be doing your eye and ear examination today. Is that okay with you?
Yes, it's fine.
I'll do the eye examination first. May I know your name?
My name is Euginia.
Age?
My age is 21 years old.
Okay. I'll wash hand first. First, I will do the visual acuity test, which we will be using the Snellen chart, and make sure the patient should sit 20 feet away from the chart. For visual acuity test, I will ask the patient to cover his right eye first, and so can you read the smallest letter which you can see?
D-E-F-P-O-T-E-C.
Okay, good. And the other eyes?
D-E-F-P-O-T-E-C.
Okay, so the visual acuity test is 20 by 20, which is normal. Okay, next is the visual field by confrontation. Here we have a static finger wiggle test and the kinetic red target test. First, I'll be doing the static finger wiggle test. Just tell me if you can see my finger, okay?
Yes. Yes. Yes.
Okay, now I'll ask the patient to close his eyes. Just close one eye.
Yes. 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 Yes.
Next is the kinetic red target test, which I will be using with the pin with a red top. Just tell me what's in the red top, okay?
Yes. 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 Yes.
Now I will check for the eyebrows, eyelashes, the eyelid to check if there is any, make sure if there is any lesion, edema, color of the lid, and a bit of palpebral fissures. Okay, and I will check for the conjunctiva and sclera. Up, down, side, up. Okay, the sclera is white and the conjunctiva is pinkish. Now I will be checking for cornea and lens. Okay, there is no opacities, and now I'll be checking for iris. There is a little light bulb, which is normal. Now I'll be checking for pupils, and for pupils I need the light to dim to check for the size, the shape, and the symmetry of both pupils. Okay, now the light reaction. For the light reaction, I will be testing the pupillary reaction to light, which is the direct reaction and the consensual reaction. Okay, for direct reaction, I can see the constriction of the pupils on the same eye. For the consensual reaction, I can see the constriction of the pupils on the opposite eye. Okay, now for the near reaction. For the near reaction, I will ask the patient to look at the tip of this pen and I will draw this pin near close to his nose. Okay, just look. Okay. Okay. Now I'll be checking for the extraocular muscles to check if there's any conjugate movement of the eye, nystagmus and the line. And I will also be checking the test for the 6 extraocular muscles. I will ask the patient to look at the tip of my finger. Okay, so just focus. Look at the tip of my finger and I will draw a pattern. Okay. And the next examination is a ophthalmoscopic examination, which I will be using with this ophthalmoscope. And I need a light to dim. Okay. Now I'll set this ophthalmoscope at the 0 diopter. Okay. So now I will check for your eye. Please look at the distance. Okay, I'll be looking for the red reflex. Okay, I can see it. And now I'll be checking for the optic disc. Okay, I can see the optic disc, the arteries, the vein. Sir, now please look directly here. I'll check for the retina, the fovea and the macula. Okay, and with that I finish the eye examination. Okay, so we've done with the eye examination. Now we'll proceed with the ear examination. So, first I will inspect the auricle to see if there is any deformities or lesion on lungs. Now I will do the drug test to check if there is any internal inflammation or discharge, and also the external otitis. And with that, I'll pull the auricle upward, downward, and outward, and also check the tragus. So, do you feel any pain?
No.
Okay. The patient doesn't feel any pain. So there is no tenderness, which shows no sign of mastocytosis. Now we will proceed with the examination of the ear canal and the eardrum using the otoscope. To do this, I will be using the largest spectaculum that can accommodate the patient's ear canal. Okay, so can you and now tilt the head of the patient slightly to the left and insert the otoscope slowly in the ear canal. I will check if there is any redness, swelling or inflammation inside the ear, and check for the eardrum, which is slightly grey. I can see the cone of light, the malleus, the umbo, the pars flaccida, and the pars tensa. And for the left side, the same procedure is followed. And the next test is for auditory acuity, which include the whisper voice test, Rinus test, and Weber test. First, I'll be doing the whisper voice test to check if there is any hearing impairment. Now I will stand 2 feet behind behind the patient and I will whisper from one side of the ear of the patient and ask him to repeat after me. I will drop the triggers of the patient from the other side.
One, two, three. A, B, C.
The patient heard correctly, which shows there is no hearing impairment. So now I'm done with the first test. Now I'll do the second test, which is Rene's test, to compare the air and bone conduction. The first part, I will place lightly a vibrating tuning fork on the mastoid bone, and the second part, I will place it perpendicular to the patient's ear. Sir, tell me when you no longer hear the sound.
Hold on.
So, which part do you hear more louder?
Near the ear.
Which shows that the air conduction is more louder than the bone conduction. So, with that, we're done with the Rene's test. Now we'll proceed with the next test, which is Weber test, to check if the hearing loss is conductive or neurosensory in origin. With the help of this tuning fork, I will place it in the head of the patient and ask if he can hear the sound equally on both sides or just one side. Sir, did you hear it on one side or both sides?
Both side.
Which means the hearing of the patient is normal.